global dimensions in the 1970s, but efforts aim at addressing the menace of poverty gained currency in the 1990s, according to the World 2023. And since then, poverty alleviation programs has remained the overarching goal of development policy, with many nations adopting social protection programs in the 1990s or since the 1990s to fight poverty and cope with livelihood vulnerabilities. In Ghana, the Livelihood Empowerment Against Poverty, LEAP, was launched as a flagship national cash transfer program in 2008 to address poverty and sustain livelihoods. The problem: the Savulu Municipal Assembly is one of the districts that were first to implement the LEAP intervention in Ghana. However, it is a home to many households characterized by pronounced deprivation. Besides that, since the implementation of the LEAP intervention, the debate is ongoing as to its effectiveness in fighting poverty and addressing livelihood vulnerabilities. In addition, if you look at the Savulu Municipal Assembly, there is hardly any literature, to the best of my knowledge, on the effects of the LEAP intervention on beneficiaries, particularly the aged and persons with disabilities. It is on the basis of this that this research is carried out. So there are two key objectives. The first one is to ascertain the responsiveness of the LEAP intervention to aging and disability-related poverty and livelihood vulnerabilities. It is going to focus on livelihood assets, accumulation, household food security, household income security, access and utilization of healthcare facilities, and then some recommendations. This study was also guided by three key propositions. One of them, social cash transfer through the LEAP policy intervention does not guarantee asset accumulation amongst the aged and persons with disabilities. Two, social cash transfer through the LEAP policy intervention does not guarantee economic participation by the aged and PWDs, and social insurance through the LEAP intervention does not guarantee access to and the utilization of healthcare facilities among the aged and PWDs. This study was anchored on the sales entitlement theory. The basic idea is that the poor are unable to, they have what we call entitlement failures, that they lack access to certain basic assets in life with which they will be able to undertake certain economic activities to be able to generate the desired livelihood outcomes. So this study is informed by the entitlement theory. The endowment set is the assets that they are supposed to have access to. And when they have that access, by means of entitlement mapping, they are able to convert the assets into an entitlement set, the desired livelihood outcomes. Yes, on the basis of that, the study was informed by the GFID Sustainable Livelihood Framework as a conceptual framework. So basically, the poor are in an environment where they are exposed to various forms of vulnerabilities. But by having access to livelihood assets, 5 of them, they are able to, and then within certain transforming structures and processes, the necessary continual environment is created for them. They are able to undertake livelihood strategies in order to generate needed livelihood outcomes, such as improve incomes, reduce vulnerability, food security, among others. Now, to make it more suitable for this study, the framework was modified a bit, especially in terms of the asset component. In the original framework, we have 5 assets, a pentagon, but here we have 2 to reflect the assets that the beneficiaries have access to as far as the LEAP intervention is concerned. In this case, cash, and then the health insurance component. Then the transforming structures and processes, we also modify that to reflect the local situation, running through the ministries, departments, then the participating financial institutions to the local volunteers for focal pensions, among others. So on the basis of this, we expect that the poor or the beneficiaries are able to undertake livelihood strategies in order to improve their situation. Now the methodology. Yeah, so this study was informed by the pragmatist philosophy. And so a mixed method approach was used to collect both quantitative and qualitative data for analysis. Now, using the money equation, a sample size of 272 was determined and apportioned among 6 selected beneficiary communities for the study. Yeah, so this is the map of the Sabro Municipal Assembly in the northern region of Ghana, and showing some of the 6 communities that were. Yes, now on the findings. First, on the livelihood asset base. Nearly 51% of the beneficiaries reported having witnessed improvement in their livelihood asset base, majority of them in terms of the financial assets. And it was found by a chi-square test analysis that there was statistically significant improvement in all 5 livelihood assets of the beneficiaries. Yes, so in focus group discussion, it emerged that the LEAP intervention has helped to improve my financial, social, and human capitals. I'm able to get some cash from time to time, which I use to support my children's education and participate in social gatherings. A finding which is consistent with others findings such as Hannah et al. 2022 in the literature. But this finding contradicts the proposition that social cash transfers through the LEAP policy intervention does not guarantee asset accumulation among beneficiaries. Then on household food insecurity, it was found that about 92% of households were found to be food insecure. And this was, in terms of the aged, about 90% of households of the aged were found to be food insecure. And then 97% in terms of households with PWDs. And this is inconsistent with existing external literature such as Poe et al. 2019, who found strong effect of social protection interventions such as the LEAP on food security. Then we move to household effect of the intervention on income security. And it was found that the intervention positively impacts on household income levels, as about 54% of them reported having witnessed improvement in their. Yes. Now, this finding, however, indicated that households, even though they were able to witness improvement in their income levels, but they failed to translate improvement in their income levels to income generating activities. And this is due to lack of startup capital and entrepreneurial skills among the various households. This finding confirms the proposition that social cash transfers through the LEAP intervention does not guarantee economic participation. Then, in terms of health, access to health and utilization of healthcare facilities, nearly 77% of households witness improvement in their health conditions. And in terms of access, about 70% of them witness improvement in their in access to healthcare facilities. So, an officer at the Department of Social Welfare reported in an interview as follows. In terms of impact, the health insurance component has also improved access to healthcare facilities among beneficiaries. And this is in line with extant literature and contradicts the proposition that social health insurance through the LEAP intervention does not guarantee access to and utilization of healthcare facilities. Recommendations. It is recommended that policymakers and all stakeholders should make frantic efforts to increase the cash benefit. It was found to be so much inadequate or very much low. So there's a need to increase the cash benefit, expand the scope of the intervention, as there are many other beneficiaries, about 2.4 million qualifying beneficiaries who are still not in the program. And then there's also the need to find sustainable funding sources. Because of this inadequate funding for the program, the payment of the cash component usually doesn't come regularly. It doesn't go regularly. And then, yes, so it also leads to irregular payment cycles. Then secondly, it is recommended that entrepreneurial skills training and then the transfer of appropriate technology should be taken out so that we'll be able to enable the agents, the PWDs, to participate in economic activities in order to generate more income and sustain their livelihoods. Then there is a need to champion the cause of human capital development. And this should be targeted at children of school-going age of the beneficiaries, so that in the long run, we can break the chain of intergenerational poverty and vulnerability among them. And lastly, there is a need to ensure institutional capacity building. This is because the institutions charged at that are responsible for implementing the policy at the local level were found to be seriously undercapacitated. On this note, I thank you for the time. Thank you.